which is primarily affecting warm-blooded mammals. Right? And also this disease doesn't have a cure. So whoever person who develop clinical symptoms end up with fatality. In Sri Lanka, annually we observe around 25 to 30 human rabies deaths each year. But this is only the tip of the iceberg, because as we know, according to the injury pyramid, the most preventable part is below the sea. If I can, according to injury pyramid, there has to be hundreds or thousands of people who are exposed to rabid animals still not receiving post-exposure treatment. There will be 10,000s of people who are having near misses or having risk behaviors. On the other hand, apart from the public health concern, rabies has a huge economic impact, because government annually spending millions of rupees just to purchase post-exposure treatment. Having said that, we also have to acknowledge there are very effective and evidence-based strategies we can apply to prevent rabies and also to eliminate this disease in countries. Sri Lanka has adopted most of these strategies, and according to the Sustainable Development Goals, we have set our goal to eliminate dog-mediated human rabies deaths by the year 2030. But in order to achieve this, as a country, we should have a clear and thorough idea about the rabies disease and its epidemiology. So, in this study, our aim was to describe the epidemiological patterns and trends of human rabies deaths reported between the period of 2013 to 2022 in Sri Lanka. So, start with the methodology. This is a cross-sectional study carried out using secondary data extracted from the National Rabies Surveillance Database managed by the Public Health Veterinary Services of the Ministry of Health. Since national campaign is receiving data across the country, study setting include all 9 provinces. During the study period of 2013 to 2022, there have been 250 laboratory confirmed rabies deaths. But in the surveillance system, there were 213 investigated cases, and we also look into their death investigation forms as well. And all these 213 cases were analyzed. With that, we'll move on to the results. First, to start off with the distribution of the disease, we found that rabies cases have been reported from all the provinces. Even if you pick a particular year, still rabies cases were reported, minimum 1 case per each province. However, when we narrow down into district level, there are some districts such as Nuwara, Ampara, where there have been no rabies deaths. However, districts like Kurunegala, Gampaha and Jaffna were the districts reported highest number of rabies cases. Then we considered the population in these districts and analyzed the rabies deaths per 100,000 populations. During that analysis, we could not identify a significant disparity across districts. Moving on to the rabies cases, majority of the cases were males, and when we look at the male to female ratio, it was 3 to 1. This difference was statistically significant, and also in some years this ratio has been even 9 to 1 as well. Interestingly, we found majority of the cases belongs to the age category of 15 to 59. Why this is important? Because when we look at the international literature and global data, it clearly states that most vulnerable group is children less than 15 years. But the context and epidemiology pattern is different in Sri Lanka. Apart from that, we look into their occupational categories. It was found that majority were either laborers, cleaners, street vendors or construction workers who has been mostly working in outdoor settings. Apart from that, majority of the victims were informal sector people who are sole breadwinners, plus they were working, over 60% of people were working for daily wages. With that, we move on to the animal source. In line with the international literature, even in Sri Lanka, rabid dog is the primary source of transmitting rabies to human. However, interestingly, we found out that nearly 25% of the animals who transmitted the disease were puppies. This is important. We further look into this death investigation forms. We realize these particular victims has grossly underestimated the potential risk of transmitting rabies through puppies. So this is an important point we found. Apart from that, with regard to the responsible rabid animals, over 95% were not vaccinated against rabies. Moving on to the host, to start off with the injury site, the foot and toes was the commonest injury site. Second goes to the hand, and third place goes to the face injuries. Unfortunately, we observed that over 80% of the victims have not gone to hospital following the animal exposure, which was an unfortunate thing. And on the other hand, we identified there were 37 individuals who have gone to hospital following the exposure, still developed rabies, of which majority, despite they go to hospital, their compliance for post-exposure treatment was not good. On the other hand, there were very few people, despite they had completed the entire post-exposure treatment, still they developed rabies, and it was observed that in most of these cases, they had major face bites during their exposure. We further analyzed the association to calculate the incubation period, where we calculate the interval between the animal exposure to onset of symptoms, and it was found to be 2.6 months. Further, we were curious to investigate whether there is any association between the exposure site to the onset of symptoms, but we could not find any association between them. Finally, we carried out time series forecasting to predict what number of cases we could expect in upcoming years, and it was found to be something around 25 to 19 cases in upcoming years. This study has several limitations. Firstly, we depend on secondary data. Thirdly, we observed that most of these death investigations were carried out following the demise of that individual. Hence, information was taken from a third party, and there were some gaps in the death investigation forms. With this, we move on to the conclusion. First, regarding the distribution of the disease, rabies cases were distributed across the country, representing all provinces. Hence, there are no rabies-free provinces in Sri Lanka. Most vulnerable group was economically active adult male who belongs to low socioeconomic backgrounds. Regard to animal source, rabid unvaccinated dog was the primary source of transmitting infection, and majority of the cases has not received post-exposure treatment following the animal exposure. With regard to recommendations, we recommend, especially from the national campaign, to revisit the death investigation process and death investigation form so that we can include some additional data which will helpful to us to understand, have a better understanding about the disease epidemiology, or to assess whether there are any gaps in service provision. Further, we recommend to develop targeted interventions targeting this vulnerable group to increase their awareness plus their health-seeking behavior. These are the references. Thank you very much.